Good afternoon, and thanks to everyone for taking the time out of your schedule to attend today's webinar. It's great to be with you, and I'm excited to be talking with you about such a timely and important topic. And it is such an important and timely topic because life science companies are continuing to face challenging financial transparency reporting obligations more and more around the world in different spots and in different ways. It's very much an evolving global transparency landscape and one that is changing pretty quickly. Now, before discussing the relevant laws and industry codes, I'm going to start off with a potentially provocative, maybe even offensive comment. And that comment is, I often find this topic a little bit dry and difficult to talk about in an exciting way. Now, for those of you whose life passion is global transparency and whose idea of fun is to study ex-US laws and disclosure codes in your spare time on the weekends, I'm sorry if I caused offense. But for everybody else, and I'm guessing that's pretty much everybody else, when I've spoken about ex-US transparency in the past, I've tried to liven the topic up a little bit by coming up with some kind of interesting theme. Last year, for example, when I did this webinar, I used Bruce Springsteen as my inspiration because the transparency movement was born in the USA with the U.S. Sunshine Act and state-level reporting requirements. And because I'm from New Jersey and required to be a huge Springsteen fan, I used Springsteen's song catalog to come up with a song title that fit the state of the transparency situation in various jurisdictions around the world. Last year, we did Blinded by the Light for France because of their Sunshine Act. We did Waiting on a Sunny Day for FPIA, which represents the European pharmaceutical industry. And we did Dancing in the Dark for Eucomed, which represents the medical device industry in Europe and doesn't have industry reporting requirements. It seemed to work out pretty well, and I got some positive feedback on it. I would often go to meetings or conferences and be greeted as a Springsteen guy, so I thought that was pretty cool. I figured I'd do the same kind of thing again this year to try to liven up this year's presentation. At first, I thought I would just do Springsteen again, but I wanted to do something a little bit different. So I tried to come up with other bands and wasn't really having much success. It was around that time that I started noticing that the different conferences and meetings I would attend where global transparency was being discussed, people, including representatives of the FPIA and Eucomed, the industry groups in Europe, would talk about a journey to global transparency. And I think when people would talk about journey, many would get the idea of the long, solitary trip on the left-hand side, one person going from one place to another, but I would tend to think of the band journey. And frankly, the band journey and their various iterations here on the right-hand side of the screen seemed a little bit more exciting, so I decided I'm going to use journey as my theme for the webinar. I knew they had a bunch of big hits. I'm not a huge fan, but I thought, I could do the same thing, come up with a song title for each country. Then I looked at their catalog and realized, Wheel in the Sky and Love and Touch and Squeezing didn't exactly correlate to what was happening in France or Denmark or the FPIA industry code. So I was going to get away from Journey, but at that point, the email blasts and notifications had gone out, so I was stuck with it, and we came up with two different alternatives about how Journey is going to be their guide today. We're going to be going on the global journey for transparency around the world that's inspired by Journey. And what we've done is two distinct things. First, during the course of the presentation today, I'm going to casually mention 5 different Journey song titles when describing something. For example, I could say something like, Don't Stop Believing that the transparency movement is happening. Now, when I say a Journey song title, you in the audience can email that song title in, the same way you would submit a question on your screen, and whoever identifies that song first will get a prize. And I'm talking about a real prize. I'm not talking about a pack of Porzio tissues or an autographed copy of my white paper about global transparency. I'm talking about a real prize. The first person who emails the song title in and gets it right will get a $10 iTunes gift certificate. So there's 5 Journey song titles I'm going to drop casually when describing something, and if you know it, email it in. And they're all on Journey's Greatest Hits album, so I haven't gone too far into their song catalog or their B-sides. And the second way that we're going to use Journey today is I rewrote the lyrics to Journey's biggest hit, Don't Stop Believing, so that the lyrics actually apply to the global transparency movement. And at the conclusion of the presentation, I plan to sing that to you karaoke style, my rewritten version, which is titled do start believing. So during the course of today's presentation, please do your best to pay attention. If you're a Journey fan, you got a leg up in terms of getting those $10 gift cards. And I hope that everybody's able to, email those in and get one. Another quick thing right up front, and I know people have already emailed in a few times, these slides will be available, so you don't have to try to furiously copy down the detailed requirements that we have up here on a few slides. If you email us and let us know you want them, we'll be happy to send those to you. And as we kind of take a quick tour of the transparency hotspots around the world today, I'm not going to get bogged down in all the minute details of the various laws and codes that we'll be talking about. That kind of detailed information will be available in the slides, and I want to kind of keep it high level so that we can jump around and hit all the key jurisdictions and not get too far bogged down in any particular country. So we'll be talking a lot about laws, industry codes, with a particular focus on FPIA's disclosure code and how that's being implemented across Europe. A couple big themes to keep in mind as we go through this afternoon. First, is the financial transparency reporting requirement contained in a law, or is it contained in an industry code? Now, by way of explanation, when I talk about laws or regulations this afternoon, I'll be referring to some kind of governmental action, a governmental imposed requirement, like we see here in the U.S. under Sunshine Act and open payments. On the other hand, when I refer to codes, I'll be referring to voluntary codes that are promulgated by different industry groups and associations, like FPIA, which represents the European pharmaceutical industry, and its national members associations. Now, this type of industry code does not have the same legal impact or force as a law or a regulation that's promulgated by the government. However, these codes are binding on members, and a violation of the industry code can lead to penalties in certain circumstances. Just at a high level, some of the countries that we'll be talking about, France and Denmark, have reporting laws that have been adopted. And in those instances, we often see that the laws apply to both the pharmaceutical industry and the medical device industry. So whether you're a medical device company or a pharma company, in certain countries you have reporting requirements under the law. In contrast, we have not seen, and this is the second big theme to keep in mind, the differences between the pharmaceutical industry and the medical device industry. The pharma industry is much further along than the med device industry in terms of adopting industry codes that contain reporting requirements for their members. A key illustration of this is the different approaches taken by FPIA, which represents the pharma industry in Europe, and EUCOMED, which represents the medical device community in Europe. We'll get into more detail about this later, but FPIA in June of 2013 adopted a new disclosure code, which I'll refer to as the disclosure code or alternatively as the transfer of value code, that requires individual level HCP and HCO reporting beginning in 2016 to cover 2015 data. In contrast, EUCOMED has not adopted financial transparency reporting requirements for its members in any of its codes or guidelines. So in a sense, it could be said that the pharma industry and the medical device community have gone their separate ways and are worlds apart on this issue. So we're going to start off with the laws. First, as an initial matter, I want to point out that there are no European Union directives or regulations that have financial transparency requirements for the life sciences industry. The governing EU directives for pharmaceuticals and medical devices and their amending instruments do not impose reporting or disclosure requirements for financial interactions with healthcare practitioners. Sorry, the slides froze up here for a second. The first country that we're going to talk about in terms of having a reporting law is France. I'm sorry, I see that we have the first winner of the song title for Separate Ways, Worlds Apart. So congratulations. So that's 1 of 5. We have 4 more to go. Getting back to the substance of the presentation, the first country is France because its Sunshine Act is probably the most well-known and controversial in Europe. Before we get into the law's provisions, it's kind of helpful to provide a little bit of background so we can understand why it was passed and gain a better understanding of some other issues that we can look out for in other jurisdictions where there may be additional transparency requirements if the same kind of problems happen as happened in France. With respect to the enactment of the French Sunshine Act, the diabetes drug mediator was prescribed for approximately 30 years for French patients to about 5 million patients. It was a diabetes drug, but it was also prescribed for weight loss purposes, and ultimately there were allegations that the drug led to possible cardiovascular risks. It led to the drug being pulled off the market, and there were a lot of public outcry and so investigations, and most significantly for our purposes, a large medical area reform act was enacted called the Bertrand Act, or the Bertrand Law, in honor of the French Minister of Health who was there at the time. This law was enacted in December of 2001, and it has a sunshine provision as well as a number of other provisions. For example, it strengthened the government agency in terms of its ability to investigate and provide surveillance over drugs and medical devices and provide for additional monitoring and surveillance. I'm sorry, I just want to mention, in addition to one correct song title, we have a number of people asking how to submit the song titles. So I apologize, I should have mentioned that before. Just type your answer into the question section on the webinar screen, and then we'll be able to see that in addition to any questions that you might have. So in addition to song titles, if you have a question about anything that we're talking about today, please send those in as well. So the Bertrand Act, passed in December 2011, generally it applies to both the medical device industry and the pharmaceutical industry, and requires companies to disclose in a public way the agreements that they have with and certain benefits that they provide to a list of specified recipients. Violations can lead to both criminal sanctions and civil sanctions, as you see here in terms of a representative example of what may happen. The law was passed in 2011, and it required companies to begin capturing data in January 1, 2012, and required the French government to issue a final decree by August 1, 2012 that would spell out the details of the reporting system. That date came and went, and there were a number of drafts that came out, but it wasn't until May of 2013 that the final decree was issued. The Ministry of Health issued the final decree with the reporting requirements, followed that up and later in May with a circular that provides additional guidance about portions of the final decree. And then in December of 2013, the Ministry of Health also issued an order to further outline some of the requirements and specifications for the French reporting system. And as I said, the final decree imposes two main requirements in terms of disclosures: for agreements that companies have and certain benefits that are given to entities and individuals. In terms of who has to be reported on, there are 9 distinct categories of individuals and/or groups or entities that companies need to be aware of and track their spend for. We have healthcare professionals up top, physicians, nurses, but it does not apply to a company's own employees. We have associations of HCPs, health facilities, foundations, a couple miscellaneous ones in terms of editors of prescription dispensing software. But these are the 9 categories of recipients that companies need to be aware of in terms of who they're reporting on. Now, I said that agreements get reported on and benefits get reported on. For agreements, companies have to reveal the following information: the identity of the parties to the agreement, and then within that, you have, for HCPs, specified information, healthcare students, specific information, for entities, different elements: their name, corporate purpose, registered address. You have to include the date the agreement was signed, the subject matter, which can be framed in such a way as to protect confidential and trade secret information. So, companies have some leeway and discretion in terms of how they phrase it. And also the program of promotional or scientific events, if that's what the agreement is about. Significantly, it's important to note that the amount of any agreement, if an amount is involved, does not have to be reported as part of this reporting requirement. In terms of benefits, companies have to report on benefits that they provide above a threshold. That threshold is 10 euros, inclusive of value-added tax. So that's a pretty low threshold. So once you hit that 10 euro threshold for an HCP or an organization for benefits, that has to be reported. And the benefits we're talking about are meals, very similar to what we see here in the U.S. in terms of the information that has to be reported on for the benefits. In disclosing the benefits, companies have to identify the recipient, personal information about the recipient, much in the same way as they have to report on the agreements. Now, in terms of timing, the agreements have to be reported within 15 days of the signing of the agreement. In contrast, benefits have to be reported on a biannual basis. Benefits that are provided to an HCP or one of the other recipients during January to June of a calendar year have to be reported by August 1. Benefits that are provided during the latter 6 months of a year have to be reported by February 1 of the following year. That information will then be made public on a central website that I'll talk about in a moment. So the agreements have a very strict timeline of 15 days, so it's very important for companies to be able to track that and comply with that very quick turnaround time for the reporting requirement. Currently, there's a pending decree, a proposed decree, that would change the 15-day requirement for agreement reporting and put it on the same schedule as benefits, so it would be biannual reporting for the first and last 6 months of a year. But that's just pending as of now. The 15-day requirement remains in place unless and until it is changed by that or some other type of decree. Now, as I mentioned, there's a governmental website for French reporting. As I noted before, there was an order that came out in December of 2013 whereby the French government set up the website. Companies are required to log in, get certain information into the system, and then they report their agreements within 15 days there, and or they do their benefit reporting twice a year there as well. The website is available to the public, is made available to the public in June of this year. It's called the Public Transparency Database. We'll provide the web link for those of you who would like the slides. It's much easier for us to do that rather than for me to try to repeat it to you. It's searchable by HCP, so anyone can go in. It's in French. Their information has to be reported in French. So it's important for companies who are operating in France and doing business in France, to the extent that the French Sunshine Act applies to them, keep track of their spend on French HCPs and the other recipients and comply with the reporting requirements that are there. Now, although France is the most well-known European country to adopt transparency reporting requirements, several others have been involved as well. Denmark, for example, has been on the journey to transparency. I'm just saying journey. It's not a song title, not self-titled or anything like that. Denmark has been on the journey for quite a while. For some time, pharmaceutical companies have had to report certain information to the Danish Health and Medicines Authority about doctors, dentists, and pharmacists with whom they've collaborated. They have to report about the name, the address, the dates of collaboration with the HCPs, but they do not have to report in the past or currently on any amounts that they actually spend during the course of those collaborations. Also, HCPs have to obtain permission from the Danish government before they can enter into a relationship with or collaborate with a pharmaceutical company. But that system is being modified by legislation that the Danish Parliament passed earlier this year, and that goes into effect on November 1 of this year. Now, the obligation for HCPs to get permission from the government applies not only to their collaborations with the pharmaceutical companies, but also medical device companies as well. The medical device companies are going to have to do the same kind of thing in terms of reporting on the relationship that they have. Again, the financial transparency piece of it in terms of the value and the amount spent does not have to be reported by the pharmaceutical company or the medical device company. In fact, the legislation imposes a new primary reporting obligation on the HCPs themselves, not the life sciences companies. The HCPs are the ones who are going to have to disclose in Denmark the amount of fees that they receive for research, like clinical research, fees for education and speaking, consultancy fees, market research events, and other sponsorships. And this information is ultimately going to be made available on the Danish Health and Medicines Authority website. So it's different than France and the U.S. in terms of the HCPs being the one with a primary reporting obligation, as opposed to the pharma or med device companies. Reporting obligations still exist for the companies, but not on the financial aspects of it. Some other countries that have been involved in financial transparency, Portugal, they enacted a law and then amended a law last year, 2013, that requires pharmaceutical companies to report certain interactions that they have with patient organizations and in certain instances others. There's also a reporting obligation imposed on HCPs, similar to Denmark, to actually report on support that they receive. That information has to be logged in to a central registry, similar to what we see in France and to an extent here in the U.S. Romania, earlier this year, adopted a new law that's going to require medical and device and pharmaceutical companies to report to their Ministry of Health all sponsorship activities and any other costs for doctors, nurses, professional organizations, and patient organizations. Apparently the recipients will also have some reporting obligations. The Romanian law charged its Ministry of Health with coming up with regulations and a system to put this system in place. We're still waiting the final details on that, so it'll be interesting to see how that gets fleshed out. Slovakia passed a law in 2011 that included some transparency reporting requirements. Under that system, companies have to annually submit a report to the Ministry of Health about the value of advertising and marketing expenses and certain non-monetary benefits that they provide to HCPs. There's personal identifying information that companies have to report as part of that as well. So those are a few of the other countries where we're seeing in Europe some discrete reporting requirements. Estonia is another country. We don't have the flag up here. It sometimes gets lost in the mix because it's not a true Sunshine Act, if you will, but by February 1 every year, companies have to submit a report to the State Agency of Medicines about the support that they provide to different categories of HCPs. In Spain, we see some localities, Madrid, Catalonia, have some reporting requirements. Again, not broad sunshine like we see in the U.S. or France, but more discrete reporting whereby they have to report on advertising expenses and some other types of spend that they have on doctors during a year, and that's an annual report in both Madrid and Catalonia. So those are the main countries that we're looking at in terms of Europe, with the main one being France and a couple others. So one of the big concerns, obviously, for the life sciences industry is whether more countries are going to adopt their own sunshine laws and their own reporting requirements. And as we can see from France and Denmark and the U.S. experience, some of the other European countries, the laws are not consistent with each other and often impose difficult, inconsistent, conflicting reporting requirements. So it's difficult to come up with a system that can account for all the different ones because they're all different and require different information. So because of the difficulties associated with it, it's fair to say as a general matter that industry is going to want more industry-based regulation, self-regulation through industry codes rather than more laws. And there is a concern that there will be more laws out there. For example, Scotland has passed or is in the process of an initiative and referendum process whereby a doctor started this there. He started a petition to adopt the Sunshine Act, and that's going through the Scottish parliamentary process, so you need to keep an eye on Scotland. In Canada, a couple HCPs are starting a website and advocating for U.S. Sunshine Act requirements in Canada. The Philippines has on and off had legislation trying to pass requirements for both pharma and med device. Australia has historically tried to adopt some things with respect to the pharmaceutical industry. There was legislation pending last year that got defeated, and we're seeing more pharmaceutical self-regulatory actions in Australia that we'll talk a little bit about later. But it's real, this danger that more countries will try to adopt it. Another country, again, not in Europe, but Colombia, the Ministry of Health has put out a proposal that would, a draft resolution that would apply to both pharma and medical device that would require reporting in a way roughly similar to the U.S. in terms of the various transfers of value and the categories that they would be required, Under this draft proposal, there would be kind of a voluntary stage that would begin in January of 2015. There'd be 2 different reporting periods, and then the mandatory phase of the reporting would kick in 2016, and it would be an annual report going forward. It's just a draft right now, but these are some of the hot spots around the world that companies need to be cognizant of to be sure that they're aware of what's happening. And because of these various laws and seeing what happened in France, we can see, and I alluded to it before, the pharmaceutical industry has been fairly aggressive in trying to develop a self-regulatory system that would require more of a one-system approach, and we're going to get into that a little bit now. Before we talk about FPIA, which represents Europe, I just wanted to mention the Global Pharmaceutical Group, the International Federation of Pharmaceutical Manufacturers and Associations, the IFPMA. They have a code of excuse me, Code of Pharmaceutical Practices. It was adopted most recently and amended in 2012. It broadly governs the relationship between pharmaceutical companies and HCPs, but most significantly is it does not have any disclosure or reporting requirements. So it's just something to be aware of. FPIA, I mentioned it, is the representative group for the pharmaceutical industry in Europe. It's made up of national member associations of 33 different countries. There are 19 full members that we have here. There are also 14 affiliate members. So all of these countries have quote-unquote little FPIAs in their country that implement FPIA's rules and codes. In addition to having these 33 national member associations, there are 40 companies that are members of FPIA. Some of the larger pharmaceutical companies participate in FPIA and are involved in the development of the various codes. Now, I mentioned before that FPIA has a disclosure code, and that's what we're going to spend most of our time talking about. But it's important to point out that there are two other codes that FPIA has in place too. The first one is the HCP code on the right-hand side. That was first adopted in 2007 and was most recently amended and approved earlier this year. That code governs all different aspects similar to the IFPMA code with respect to the relationship between companies and HCPs, but there are no reporting requirements in the HCP code. On the left-hand side, we have the patient organization code. That was most recently amended in 2011, and this does contain some reporting requirements that have been in effect since January of 2012, whereby FPIA members are required on an annual basis to report, basically put on their website, the amount of support that they provide to patient organizations. That's been in place for a couple of years now, and companies under that code have been required to show the support that they provide, name the patient organization, and also describe the nature of the relationship. Also, companies are required to provide, if they are engaged in a contractual relationship with a patient organization for services, they have to report on that too. So although a lot of the focus is on the FPIA disclosure code, companies need to keep in mind and be aware of the patient organization code because there are some reporting requirements there too. But the main reason we're here, or at least I'm here, is to talk about the FPIA disclosure code. This was adopted in June 2013. It was amended slightly earlier this year and went into effect, as you can see, in June of 2014. And in terms of deadlines, first reports are due in 2016 to cover 2015 data. And really this FPIA's decision to get involved with the disclosure code was motivated by its view that its prior codes, the HCP code, the patient organization code, were outdated. They weren't keeping up with the transparency movement that was happening in various governments, also the transparency directives that you see coming out of the European Union. So FPIA wanted to kind of try to get ahead of the curve and prevent more governments from getting involved. They didn't want more Frances. They didn't want 33 different laws, inconsistent patchwork maze across Europe of different reporting requirements. So FPIA's goal really was to bring some sense of uniformity via this self-regulatory process through this disclosure code. Now before we get into some of the details of the disclosure code, I just want to explain that these FPIA codes apply to the member companies of FPIA, the 40 that we showed before, their subsidiaries, and any companies that are affiliated with those FPIA member companies or subsidiaries. Now, although there are 40 members of FPIA, companies can also choose, well, maybe I don't want to be a member of FPIA, but I want to join the British group that's part of FPIA. In the UK, it's called the ABPI. So a company can be a member of the ABPI without necessarily being part of the larger group of FPIA. So it's important for companies as they're thinking about what their reporting requirements are to figure out, A, am I a member of FPIA? And if not, am I a member of any of the national member associations that are part of FPIA? Because that will govern whether or not you have to report in a given jurisdiction and how your reporting obligations are going to work within your companies. Now these codes that FPIA has adopted, including the disclosure codes, lay out the minimum standards that all the national member associations have to include in their own national codes. So the way it works is if FPIA passes a disclosure code, then each of the 33 national groups have to include those provisions into their own codes. The national members can adopt provisions that are stricter than what FPIA requires, but they can't be less strict. So in essence, FPIA sets the baseline. And although it sets the baseline, FPIA would really like for the national groups to just kind of adopt it in wholesale without major deviations or differences, because if each group, each country tweaks it and does something a little bit different, that defeats the purpose of having one uniform system. And for the most part, FPA member associations have been pretty consistent in adopting the code, but there are some differences that we'll talk about a little bit. And again, I just want to reiterate, FPA applies only to the pharmaceutical industry. This is not applicable to the medical device community. We'll talk about what the medical device community is doing later, but if you're a medical device company, this is more background information to see where you ultimately may be going in terms of transparency reporting requirements. Now, we talked about timing, January 1, 2015. That's when data collection begins. First reports, 2016. What has to be reported? There are two different types of recipients that we'll talk about. First is an HCO. An HCO is a healthcare organization, so it's a legal person. It can be which is a healthcare, medical, or scientific association or entity. We're talking about hospitals, clinics, foundations, universities, teaching institutions, those type of things. So that's what an HCO is. And under the disclosure code, companies have to report on the individual level for each HCO 3 different categories. They have to report on donations and grants that they make to HCOs, their contribution to costs of events, which include sponsorship agreements, registration fees, travel and accommodation, and fees for service and consultancy with respect to their relationships with HCOs. These are reported both as to fees and expenses, and they're reported separately. And in a few slides, we'll show you the reporting template that FPA has developed for that. In addition to HCOs, we have HCPs. Those also have to be reported on the individual level. Under the FPA code, HCP is defined as any natural person who's a member of the medical, dental, pharmacy, or nursing professions, or anyone else who can prescribe, purchase, supply, recommend a medicinal product during the course of their professional activities. So we're talking about basically doctors, prescribers, nurses, people like that. And just like HCOs, companies have to report on these 2 categories: contributions to costs of events and fees for service and consultancy. Donations and grants are not reported for HCPs because companies cannot give donations or grants to HCPs. They can only do that for HCOs. So FPA set up the system, individual level reporting for HCPs and HCOs. However, some things can be reported in the aggregate. 2 different categories. First, research and development activities are reported in the aggregate. So companies in a given jurisdiction can report their transfers of value to both HCPs and HCOs relating to non-clinical studies, clinical trials, non-interventional studies that they're conducting as one aggregate number. They total up all their R&D spending in the country and include that on their report as one number. And really FPA's goal, as they've said, is they would like to have one really large number to help with their PR battle to show that, yes, we are spending on individual HCPs and working with them and consultants, but look, public, newspapers, skeptics, cynics, we also are doing a lot of good work through R&D. Check out this really big number that we're able to use to counterbalance some of the smaller numbers that we use when engaging with HCPs. The second instance when companies can report in the aggregate is when they cannot report at the individual level for a particular HCP or HCO for a legal reason. The main one is a lack of consent, which we'll be talking about. So if for some reason a company can't report an individual's name, they can't say that Dr. John Smith was provided a transfer value of 1,000 euros for a consultancy agreement for some reason, probably lack of consent, that number gets reported in the aggregate. The company aggregates all of those HCPs or HCOs that they can't report on the individual level, and then add that together, and there's a ratio that they have to compare the number of non-consenting individuals with the individual level reporting, and that's how that gets reported on the template that we'll show. Now, the consent issue is key. Now, because the FPA disclosure code is a voluntary form of self-regulation and is not a law, and because of the data privacy protections afforded to European Union citizens under the governing EU directives and then the national implementing laws, companies must obtain the consent of a recipient in order to publicly disclose the individual level information. Now, in instances, like I said, where the recipients refuse to provide consent, companies can basically say, I'll be all right without you, in terms of I'm not going to report your individual level. I'm just going to roll that up into the aggregate and report that on the template that way. So that's how it basically works. You need to try to get consent by companies in order to report the individual level, and if you don't, if a HCP doesn't consent, then you have to report on the aggregate. And consent is not really dealt with at any great length in the disclosure code. This this language that we have here is actually taken from a footnote in the disclosure code, and it basically says FPA is encouraging companies to go out and get consent. And they couldn't really put in a broad consent is absolutely required, a mandatory, because the different nations have varying provisions on how you go about getting consent, in terms of does it have to be in writing, how does revocation work, processing of information. So FPA was aware of this and flagged it as an issue and built in this aggregate backup for the instances where companies are unable to get consent. So consent's a big issue, and we're going to talk about it a little bit more. Congratulations to the person who got I'll be all right without you. A couple other big picture things that are from the disclosure code. What language does the report have to be in? The FPA code provides that the language is whatever the national code requires. Pretty much it's going to be in the native language, the FPA code says, and English is encouraged if that's not the native language. Methodology. This is a big point for the FPA code, and it's unlike the U.S. Sunshine Act's assumptions document. This language is taken right from the code. Companies are required, it's mandatory, not optional, to come up with a methodology for how they went about preparing their reports. This methodology not only is mandatory, it has to be made public, and unlike in the U.S., there's no character limits. It's a really key part of the FPA code because there are a lot of gray areas and ambiguous questions about the code, and companies are going to have to make a lot of judgment calls about what they're reporting, how they're reporting. You have a few examples here about tax, currency, other issues, multi-year contracts. So companies have to make their decisions and then explain what they did in their methodology. And I think that's a really important part of the code, and companies are going to have to decide how detailed they want to be in the methodology. Will they do kind of an executive summary and a larger one that they keep behind? Will they do some humongous document and make that part of their methodology, every single decision that they made? It's not really clear, and companies are grappling with that as they go about preparing how they're going to do their reporting. And as I mentioned, there are a lot of gray areas, and FPA has prepared some FAQs for its members, and in the various iterations of that document and those documents that I've seen, companies will often ask some really good questions, and the FPA response will be, well, that's a really good question. It's kind of ambiguous. Just, figure it out, put in your methodology. Basically, for the close calls, FPA is saying, any way you want it, just decide, explain it, put in your methodology. It's going to be public, and if there's a big issue later on, we'll deal with it at a later time. So that's methodology and important for companies to think about. A couple other high-level things. Platform of disclosure. FPA provides that can either be on the company website or central registry or something else developed by the industry group. The reporting deadline, it's within the first 6 months at the end of the reporting period. The reporting period is a year. So first reports January 1, 2015 through December 31, 2015 by June 30, 2016, and then going forward on that schedule. Significantly, spend is reported in the aggregate by category. So you don't have to report your 100 interactions with Dr. Smith. You give Dr. Smith one aggregate number. However, you have to have the itemized backup and documents available so that if ultimately someone wants to ask you a question about it, you're able to provide the itemized documentation on that. The reports, once they're made public, have to be left in the public domain for 3 years unless somebody, an HCP or an HCO, if applicable, revokes their consent, or governing law calls for a shorter period of time. Exemptions, a couple key things here. These transfers of value are not included in what has to be reported. Transfers of value that are solely related to OTCs, transfers of value that are part of an ordinary purchase between a company and an HCP, and significantly meals, drinks, things like that, and also samples there too. Unlike the U.S., unlike France, meals don't have to be reported. Basically what FPA did is said, we're going to leave it up to national member associations to decide what's a reasonable threshold. Every member of FPA, all 33 countries, have to decide and have decided and put in their codes that companies can spend up to X amount on a particular meal. Anything below that threshold is fine, and it does not have to be reported. Anything above that threshold is in violation of the code and could lead to sanctions. So instead of having to require companies to report all of their meal spend, FPA decided on this alternate system, which is different than France, which is different than the U.S., and which is one obvious benefit of writing the disclosure code and reporting requirements. You can try to make some of these cost-benefit decisions and make things less onerous on your members. Here's the FPA template. Again, this will be in the slides. It might be difficult for you to see. I'm going to get off it pretty quick. But you can see you have your different categories and rows of information. You have your HCPs and HCOs on the left-hand side. You have R&D as an aggregate at the bottom. Up top, in terms of some of the columns, you have contributions to cost of events, fees for services. Then you, theoretically, this is simple. You just fill it out, and that's how you do it. But as we'll see, some of the national groups have taken a slightly different approach to the template. So FPA's hope is consistent across Europe, kind of with this template, makes it easier for companies to report. And by the way, governments are doing a really effective job, and there's no need for you to come in and intervene. We have this under control. Unlike FPA, EUCOMED, which represents the medical device community, has not been as proactive in adopting reporting requirements for its members. Like FPA, like IFPMA, EUCOMED is committed to high ethical standards and transparency as a general principle and requires its members act in an ethical way. And they have some, transparency reporting requirements, not this type of financial transparency reporting requirements in their code of practice. And basically, from, the sense that you get from EUCOMED, both in terms of this white paper that they prepared back in 2012, and when you hear EUCOMED representatives talk at various conferences or you're in meetings with them, is EUCOMED is kind of hanging back a little bit. In this white paper, they noted the growing global transparency movement. They talked about things that are happening in the U.S. and France and Slovakia, but they said, look, we are aware of this, but we don't necessarily think it's something that we want to do right now. And to the extent anyone's interested in doing it, here are our thoughts. We think that there should be fairly narrow reporting categories, there should be thresholds, there should be various other considerations that would make it easier on companies to be able to satisfy their reporting obligations. So EUCOMED has this white paper out there. They say that they are on a journey to transparency, but I think a lot of it is going to be impacted by how the FPA system works. If the FPA system works great and there's successful self-regulation and FPA and the pharmaceutical industry is able to show governments both in Europe and maybe around the world through the European example that they're being very transparent with a lot of individual level reporting, there's no need for governments to come in and impose their own laws, then maybe EUCOMED will come on and adopt some kind of system similar to FPA, maybe identical, just depending on how that works out. So the success or lack of success of what FPA does could have a direct impact on what EUCOMED ultimately decides to do in the future. Now, I said before, I'm going to jump back to FPA now since there wasn't a whole lot to say about EUCOMED in terms of there are no existing reporting requirements, and maybe there will be down the road. The way the FPA system works is each of the national member associations has to adopt their disclosure provisions and put them into their own code. For the most part, the codes have been largely similar to the FPA codes. One of the first big challenges I should mention is that national groups have kind of adopted them in different ways. Some have adopted a separate disclosure code similar to what FPA did. Some groups have taken the FPA disclosure provisions and put them into a larger code of ethics or a code of conduct. Some have created the disclosure provisions as an annex and then put that into a larger code of practice or ethics. So you have to be able to kind of find these things in the first place because sometimes the national member groups like to hide them a little bit on you. But for the most part, the member associations have implemented the disclosure code provisions pretty faithfully. It's not like they're saying that, I'm forever yours to FPA, but for the most part, it's been a faithful implementation. But there are some significant differences that we're going to get into now. One is the language. What language does a report have to be in? FPA says it's up to the national group to decide, probably the native language. But from that, we've seen 5 different approaches, and here's just a representative example. We have the first one. You only have to do the native language, Finland, Germany. Second option, it has to be in the native language or English. Gives you the choice. That's what we see in Austria. Others say native language is required and English is encouraged. Sweden is an example of that. Other countries say both the native language and English are required. Russia is an example of that. And we have our miscellaneous. We have Belgium, where there are 2 languages required, Dutch and French, and then English is encouraged. Switzerland is another one of our miscellaneous. They require the reports to be in English, but then they also say if you also want to do it in French, German, and Italian, that'd be great too. So you might have to do 4 different reports under that Swiss code. Another challenge, the location of disclosure. I mentioned before that FPA says it could be on the member company's website or on a central platform. From that, we've seen all different variations. We've seen some groups say, put it on the member company's websites. Others say, we'll develop a central platform. That's the second bullet there. Do some central registry reporting like in the US or France in terms of the laws. Others say it could be either or. So it depends on, I suppose, if the groups actually set something up. Some say put it on the company's website, then link it over to the national member website. Others say the opposite. Have a link on the National Member Association website back to the company website. Some haven't said yet. Ireland is in there, but we understand that their code is expected to be changed, and they're going to fall into the first category of on the member company website. And there are some groups in Denmark and France where there's legislation in place where the groups have said, you do not have to do separate FPA-type reporting. Your compliance with your legal obligations under the French Sunshine Act or the Danish Act are sufficient to satisfy your industry group requirements. So you're not having to do 2 separate reports in those instances. Another big challenge, cross-border. The FPA code says basically disclosures are pursuant to the national code of the country where the recipient has its physical address. So that sounds pretty simple. So if you're an Irish company that's a member of the Irish group, you sponsor an Irish doctor to attend an event in Ireland, that gets reported in Ireland. If it's an Irish company with an Irish HCP for an event in France, even though the event's in France, the doctor's Irish, you do that in Ireland. But what if you're an Irish group sponsoring a French HCP for an event in Ireland? That's not going to get reported in Ireland because the recipient is French. You might have to report on the French Sunshine Act, but you don't have to report in Ireland. Now, that's pretty simple, but then you can get into all different kinds of permutations about affiliate companies. What if you're a member of the Irish group and you have an affiliate in Germany and they sponsor somebody in Greece? Nobody's a member of Greece. Where does that get reported? Do you just try to put it on the Greece website? Do you do it in Germany? Does everything maybe get rolled up to the parent in Ireland? These are some of the challenges and some of the gray areas that we talked about before. The FPA code provides some guidance on how you report and gives some flexibility to companies to make those decisions. But that's a big challenge as companies try to figure out how they're going to satisfy their reporting obligations, especially in the cross-border context. Separate and apart from having to track all this different spend as different entities and parts of the organization are sponsoring different people to go to different places and interact with them in different ways. Another big challenge, the report formats. So we showed you the FPA template before. We put it back up top there. The national member associations have basically implemented this in a similar way. Sometimes it looks different. We have Lithuania up there. They have a different color scheme, and they have both Lithuanian language and English right there in terms of what has to be reported. Some templates require different address information. Some require a specialty for the doctor that's not required by FPA. Some templates require a unique country identifier. Spain does, for example. Others do not. Sometimes groups call the same thing different things. For example, Austria, instead of HCOs, they refer to HCIs. So it's a healthcare institute as opposed to a healthcare organization. That's in the code, but if you just look at the template, you're going to wonder what the heck's a HCI without knowing that it's really an HCO. So figuring out exactly what information has to be provided based on the template in a given country can be a challenge. Now I'm going to go back to consent. Talked about it before. It's really important because this is an industry code. You have to get consent. Basically, under the data protection laws of the various European countries, it applies to natural persons, HCPs, but not HCOs, who are legal entities. But there are some countries, like Austria, where data protections are extended to entities, which are HCIs, not HCOs. So in Austria, for example, you would have to get the consent of the HCOs as well as the individual HCPs. Okay, so you know that you need to get the consent. How do you get it? Do you get it once at the general, I'll just use HCPs, do you get it once at the general HCP level? Do you get it at the transaction level for every time you have an interaction with a given HCP? Do you put a disclosure language in every contract? Do you do a separate FPA disclosure type contract for the HCP? These are some of the issues that are not explicitly provided for in the FPA code, and that companies have to decide how they're going to go about getting consent, tracking consent, in conjunction with what the data privacy laws of these various jurisdictions require. Another big issue with consent is revocation. Generally, under the EU directive and the governing national laws, individuals have the right to be able to revoke their consent at any time. So you have an instance where HCP consents in January 2015, but before the report comes out in June 2016, he or she calls you up, revokes consent. As a result, you then have to take that individual level HCP, spend out of your individual level report, put it over into your aggregate. That's maybe fairly easy. But what about if the revocation happens after the publication of the report? It's not until the information hits the newspapers and the HCP remembers, oh my gosh, I gave consent back a year and a half ago to have this disclosed. Now it's out there and I don't really like seeing my name in the newspaper, so I'm going to revoke my consent. Well, in that case, under certain laws and nations, companies have an obligation to pull down that report, remove that doctor's name from the individual level, roll it over into the aggregate, and then repost that so that the individual's consent is revoked. Other countries provide only for prospective revocation of consent. So that's a big challenge for companies, revoking consent before publication, after publication, and how that interacts with governing data privacy laws across Europe. And that timeliness aspect of giving the consent, forgetting about it, might be exacerbated by the fact that there is no review and dispute process like we see here in the U.S. under the FPA system. It's not provided for in the code. The FPA has said, hey, it's a good idea to maybe interact with your HCPs, tell them that this is happening, but there's no formal system in place. And some of the national groups are dealing with this in different ways. Ireland has prepared some draft language for consent that their members could use. Poland requires their companies specifically to change whatever the reporting obligation might be. If an HCP revokes consent within 14 days of revocation, the Greece code says doctors who do not consent cannot work with members of the Greek group. There's no aggregate option. Either you consent or we don't work with you. And Spain provides some good information about a situation where, let's say an HCP gives a general consent, but then pre-publication says, you still have my general consent, but I don't want you to report those two contracts. For whatever reason, I don't want my name out there on that. In that instance, Spain says you have to report everything at the general aggregate level. So, that's how Spain does it. Doesn't mean other groups do it because that issue hasn't necessarily been addressed by all these other groups. So, something to keep an eye on. Now, you may be asking yourself, I've heard a lot about consent. You have to get it. Companies have to do it. What's the HCP reaction been? Generally, I think it's fair to say that HCPs have not embraced the FPA disclosure system with open arms. I've been at conferences where HCP reps have stood up and said, this is not a transfer of value code. This is really a transfer of bad reputation. Pharma, you're trying to make us, the doctors, look bad by saying, look at all this spend that's being paid to the doctors. So that's certainly one thing that we can do. I'm sorry, just seeing who won on that one. Congratulations. So HCPs are out there in that. And there's also other concerns. The Polish national group put out a survey that they did. HCPs are generally supportive of transparency, but they have a lot of concerns about all this information becoming public. There's also, how does this play in with conflict of interest rules? Hospitals have reporting requirements maybe for their individual HCPs. How does this all tie together? The HCPs, in a sense, might feel that they are being imposed upon, lots of inconsistent obligations, and they're being made the scapegoat of this. So HCPs have this concern. Theoretically, why would they ever consent? Well, a couple reasons. If they don't consent, and if under the FPA system companies are reporting, instead of at the individual level, just a lot at the aggregate level, that's probably not going to be good enough to convince governments to stay out. Governments want to see more individual level, more detailed reporting about what's actually happening with individual HCPs. So in that case, if there's a large percentage that's just at the aggregate, that's not going to be good enough for governments. So pharma is working with doctors to try to explain to them the benefits, rather than having more Frances and more USs, where we talk about who got that $2 cup of coffee and whether or not you ate the chicken at the meal. We don't want to do that. Let's work together to make this system work. So if PIA is working, they have these flyers, they have videos on their website, they're holding webinars, they're conducting seminars, they're out there trying to educate HCPs and tell them the benefits of this self-regulatory system, so that they can have it succeed and prevent more governments from coming in. And it's not just the HCPs that the pharma companies, the pharma member associations need to convince. They need to get other pharma companies who might not be members of FPIA or the local association. They need to get them involved too, because if all the pharma companies who are members of an association report in a given jurisdiction, and that's 60% of the market share, that might not be good enough for the government. The government might say, well, that's great, you had 60%, but what about that other 40% that's out there that's not a member? So the national groups and FPIA are trying to get non-members to either join and report as a member of the company, or just voluntarily report, hey, we're not a member of the group, but to try to help this succeed on a broad basis for the pharmaceutical industry, we're going to report so that we can have as much reporting as possible. So that's a little bit, as part of that, they have flyers. FPIA has this website, Pharma Disclosure EU, that tracks important developments, puts educational material out there. There's a couple outliers that I just want to mention quickly. The UK, for a couple of years now, has had aggregate annual reporting, interactions with consultants, but it's at the aggregate level. You don't have to name the HCPs. Those requirements are going to remain in place until the individual level reporting begins with 2015 data, with the reports due in 2016. Earlier this year, 2013, 38.5 million pounds were spent on that kind of support. So those aggregate reporting requirements will remain in place in the UK until the individual level goes into place. At first, the UK group, the ABPI, adopted FPIA's disclosure provisions pretty quickly and pretty consistently. But earlier this year, the ABP announced that it's going to amend its code, and they're going to make some significant changes. They're going to add additional categories of reporting that are different from FPIA, joint working, which is unique to the UK. They're going to require more information, email addresses, specialty, a couple of other personal identifying information about the doctors that is different than FPIA. And perhaps most significantly, they're going to require, if this is enacted, and right now it's in the consultation period, we'll know by the end of the year whether the ABPI is going to accept this. By the end of the year, we'll know whether or not, and this is the second bullet from the bottom, under the draft, HCOs, which are the entities, have to be reported on a per activity. As I said before, under FPIA, HCPs and HCOs, it's just one annual number. But here in the UK, they're contemplating individual per activity reporting for HCOs. So that's going to be a big change, and it's going to affect how companies track and then ultimately report on that information. The Netherlands is also an outlier because they've had individual level reporting that actually predates the FPIA disclosure code. Their first reports were in 2013 to cover 2012 data. Their system was inspired by the U.S. Sunshine Act. The government actually went to industry and went to HCP and said, let's work together, let's come up with a system. And it's gone in and it's worked. Companies have to disclose service agreements, sponsorship agreements, and this is new beginning next year, support for patient organizations. There's a €500 threshold for reporting, which is different than FPIA. There's a central register. We have that link there, where companies have to log in and report this information. It's an annual report. It's due within the first 3 months of a year. And that information becomes public. And the public can go in and search by HCP. So you can search for Dr. John Smith, the infamous Dr. John Smith, who's in every jurisdiction across the globe. But you can't search by pharmaceutical company. So, and we have other information. I see I'm running short on time, so I won't get into all the details about what has to be reported for service agreements and sponsorship agreements, but it's the same kind of basic report information that we see in other jurisdictions, similar to FPIA. I'm going to leave Europe. I'm going to talk about Australia and Japan quickly, and then I'm going to sing to you if I have time. In Australia, there's been aggregate reporting requirements similar to the UK in place for a few years. But earlier this year, Medicines Authority, which represents the industry in Australia, adopted a new code that will require individual level reporting beginning with 2015 data with reports in 2016. As you can see on this timeline that they've prepared, right now the code, although it's adopted, is pending before an Australian government entity, the ACCC, which has to approve it just to evaluate it from anti-competition purposes, be sure it looks okay. So it's pending right now before the Commission. Assuming that the Commission approves it, the new code will go into effect in January 2015. The Australian system is kind of a hybrid. It has some U.S. elements, it has some kind of French elements, it has some FPIA elements, and it also has some that are unique to itself. For example, in Australia, research and development spend does not have to get reported at all. Unlike FPIA, which talks about in the aggregate, in Australia, it's not reported under the current system. So, basically, you have to report 2015 data. That's the kickoff date. That gets reported in 2016. All this information is in the slides, and I'm not going to really get into it because I want to be respectful of people's time, even though I'm already a few minutes over. We're talking about transfers of value, the reporting format. It's a template that's provided in the code's guidelines. It's more detailed than we see in FPIA because you have to have the date, you have to have the type of HCP, which isn't required under FPIA, a description of service, so it's more detailed than FPIA. These are the type of fees. We're talking about advisory board, market research, educational grants or sponsorships. In terms of where is the report published, it's going to be on company websites. Consent, like FPIA, this is a code, so companies are going to have to get the consent. And then similar to the U.S., companies are going to have to provide a declaration of compliance from their most senior executive officer. There are exemptions, hospitality, food and beverages are doing the FPIA type approach whereby they're going to set a threshold and it doesn't have to be reported. So if you are below it, you're in compliance with the code. If you're above it, you're in violation, but you're not going to have to report it. You see there at the bottom, research and development. That's an exemption from reporting under the proposed code. And then sponsorship has a slightly different approach, and it's going to be under the same the same timelines as individual level HCP reporting. And again, important to keep in mind, there are current and existing aggregate reporting requirements in Australia. Japan is the last country I'm going to talk about, and it's interesting because in Japan, and for the medical device folks, hopefully you're still online and still awake, even though I'm done with the 5 Journey song titles. This is the one example where we have reporting requirements imposed by industry upon the medical device community. We have the JPMA guidelines. JPMA is Japan Pharmaceutical Manufacturers Association, and we have the JFMDA, which is the Japanese Federation of Medical Devices Association. And basically, companies are required to establish a transparency policy, and they have to publicly disclose payments to medical institutions and HCPs for both medical device and pharma companies. The data is uploaded on the company's own website. There's no central registry. Companies are responsible for doing that. And in terms of the payments to be disclosed, it's an annual report. You're looking at basically 5 different categories. And again, this applies to both pharma and medical device. We have R&D related costs, grants, donations, honoraria, information exchange costs, and meals and hospitality provided to HCPs. And again, both the pharmaceutical industry and the medical device industry. So that's unique, and we'll see if other medical device industry groups do anything similar to Japan, or if, like UCOMED, kind of hang back and see what happens with the FPIA experience. So, excuse me, with that, I'm just going to grab a drink of water. I'm going to start my singing at this point. Folks, I'm sorry. We had a bit of a technical difficulty there. I'm not going to be able to sing for you. The words are there. If you'd like, I could come to your facility. I'd be happy to do it for you there, and we'll ensure that the technology is working better in advance. But I do see that a bunch of questions came in, and again, I know I'm over time. I'll just try to hit a couple. If you have additional questions, the information is there. We'll send the slides to you if you want the slides. But let me just take a quick look at some of the questions. Let me see. Can you report it if you are not a member? Yeah, there's nothing, as I mentioned before, there's nothing stopping you. If you're a pharmaceutical company and you're doing business in the UK and you're not a member of the ABPI, you can go ahead and comply and do the reporting even if you're not a member. And some of the European groups have actual forms where you can fill out and say, I'm not a member, I'd like to comply, and you can submit that. So that's part of what I was alluding to before. The pharmaceutical groups would really love to see as many members and non-members report. I see a question. I apologize, I breezed through Australia. Someone asked if the Australian requirements that I put up before applied to both the medical device and the pharmaceutical. No, that is pharmaceutical only. The Medical Device Association in Australia has not adopted those similar types of requirements. Let's see. Oh, is FBA coming up with a master list of HCPs or HCOs? This is a common question, and as part of their FAQs, FPA provided a simple answer, no gray area on this one. The answer is no. There will not be a master list provided by FBA. Companies are going to have to use their own master lists or whatever other lists of HCPs that they have in order to be able to track and report on their information. Let me just... Is it the same definition of HCP in all countries under FPA? No, it's not. That's, we talked about some of the challenges and deviations. Some of the countries will just kind of have a cut and paste and have the same definition of FPA that I mentioned before. Others will say if you are a HCP who's licensed by and then refer to a particular statute or a law in the country. Some provide an exhaustive list that's broader than FPA. We've seen a couple where veterinarians are licensed or referenced as someone to report on, perhaps because they can administer, I'm not sure. I don't want to visit those countries, but in any event, you need to check the national group to determine whether or not HCPs are there. So a couple more questions, but I think we'll end it here. I'd like to thank you very much for your time. Additional questions, slides, please let us know. And thank you very much for attending. And if you have any questions, let us know. Thank you.